Often the question comes up, should I go out of network to come out and see you? Number one, many of the techniques that we've optimized over the years are not offered within certain insurance companies or networks of doctors. Number two, there's so much judgment involved in getting a superb outcome. One of the things they benefit from when they come to see us is the expertise and experience that I've developed over the last 30 years. The rehab team that works hand in hand with me here, our rehab and clinical offices are all in one space. And also our focus on helping people return to high-level sports. We're completely focused on how do we help that patient get back to any sport that they want to do. There's just a long range of things that go into the art form and the science of delivering superlative care. For patients who can make it out to see us, there's just another level of experience and care that they're able to access. The process often starts either with an outside consult where I'll get on the phone or a Zoom or connect with them and be able to review their x-rays and MRIs and help make a diagnosis.